Hi class, I'm going to be talking about the maternal changes and discomforts that occur during pregnancy and some interventions to help prevent them. I'm here with my kitten because he's really cute, so I thought he should be in the video too. So first we're going to talk about nausea and vomiting, and these occur due to rise in estrogen levels, and some interventions to help prevent or reduce the nausea and vomiting include eating some dry crackers or toast, eating smaller meals more frequently as opposed to 3 large meals throughout the day, and avoiding triggers that you know might make you feel nauseous or want to vomit. So that could be like a certain smell, or if certain visual things make you feel nauseous, just try to avoid those. Next, we're going to talk about heartburn and GERD, and these occur due to the rise in progesterone, and also in the later weeks of pregnancy, there's pressure on the stomach from the enlarged uterus, so that can kind of give you the heartburn as well. Interventions for this are pretty similar to nausea and vomiting, so eating smaller meals more frequently, taking some low sodium antacids such as Tums, and avoid overeating and eating excessively fatty foods like a meal full of fried food. It's probably going to worsen the heartburn. Next, we're going to talk about skin alterations, and this can include chloasma, linea nigra, spider nevi, and striae gravidum, and these occur due to the rise in estrogen, and they can also occur due to really rapid weight gain, such as the stretch marks. So interventions for these are to avoid excessive sun, which anyone should be doing anyway to prevent sun damage. Try to avoid excessively rapid weight gain to reduce the stretch marks, and then only gaining the amount of weight recommended for the trimester and the pre-pregnancy weight status. Next, we're going to talk about urinary frequency, and this occurs due to hormonal changes in the first trimester, and in the later trimesters, pressure from the uterus because it is enlarged, is pressing on the bladder. So interventions would include voiding frequently, taking frequent bathroom breaks, and then decreasing fluid intake in the evening to reduce urgency during sleep time. Fatigue is another discomfort that may occur. It's due to hormonal changes and weight change. Interventions include planning a rest and nap schedule and taking breaks when necessary, and then seeking assistance when you need to. Tucker's pretty fatigued. He fell asleep. Next, we're going to talk about breast tenderness. This occurs due to the rise in progesterone, estrogen, HPL, and the enlargement of the breast size. Interventions include finding a well-fitting supportive bra, leukorrhea, which is a gray or white mucoid discharge, which can have a musty scent. It occurs to help form the mucus plug due to the rise in estrogen. So interventions for this include hygiene, avoiding the use of douches, and acknowledging that there is a higher risk for yeast infections. Next, we're going to talk about nasal stuffiness and epistaxis or nosebleeds. So this occurs due to the rise in estrogen, and interventions include using a cool air vaporizer and avoiding the use of nasal sprays or decongestants that might irritate it. Next, we're going to talk about ptyalism or excessive salivation. So this occurs due to an unconscious decrease in swallowing, which could happen because of the nausea, or stimulation of glands when eating starch, as well as the rise in hormones. So interventions include using an astringent mouthwash, chewing gum, or sucking on hard candy to kind of reduce it. Next, we're going to talk about dependent edema. which is due to third space fluid from dilated vessels. So this is edema that occurs in the lower legs and feet. And interventions include foot exercises and elevating your feet and legs. It's also important to educate that if the edema becomes non-dependent or occurs in the arms and the face, that you should talk to the provider, because that is not a normal discomfort. Varicose veins might occur, and interventions include elevating the legs frequently, wearing support hose, and avoiding long lengths of time standing and crossing legs. So taking breaks if the job includes standing a lot, taking time to sit down in between. Constipation is due to the rise in progesterone, and taking prenatal vitamins, which may have iron, and also pressure on the intestines from the enlarged uterus. So interventions include an increase in fluid intake, so drinking more water throughout the day and other fluids, fiber and regular exercises, and trying to have regular bowel habits and avoiding resisting the urge to use the bathroom. Hemorrhoids might also occur, and interventions for this include trying to avoid and prevent constipation, and some therapeutic interventions would include using ice packs, topical ointments, and Tux pads in a warm soak or a sitz bath to help alleviate the pain. Backache might also occur, and this is because due to pregnancy there might be a lordosis stance, so that's when the lower back is pushed forward. So interventions for this include using proper body mechanics if you're lifting anything, although you should not be lifting anything heavy during pregnancy, doing some pelvic tilt exercises, and wearing comfortable supportive shoes. Abdominal discomfort and round ligament pain are due to the ligaments that anchor the uterus are growing as the uterus grows with the fetus. So that might cause some discomfort and pain, and interventions include flexing the knee and hip on the effective side and using heat warm compresses and avoiding stretching. Leg cramps also occur due to changes in potassium and magnesium levels. Interventions include dorsiflexion of the feet, and using some warm compresses as well. Faintness, or the feeling that you're going to faint, might also occur, and this is because there's pressure on the inferior vena cava, which causes hypotension. So interventions include taking your time when you're changing position, avoiding standing for long periods of time, and not lying flat on the back during the second or third trimester, because that will increase the pressure on the vena cava. So definitely when getting up from bed, taking a few minutes from sitting to standing will help reduce that faintness when you stand up. The last item we're going to talk about is dyspnea, or difficulty breathing. This occurs because the uterus presses on the diaphragm and the lungs, resulting in breathing deeply becoming difficult. So interventions include assessing the severity and talking about it with the provider, using proper posture, which I was not doing, and then using pillows when sleeping to kind of help breathing throughout sleep. So that's all I have to talk about. Good luck on the test tomorrow. Here's a goodbye from the kitten. He's so cute.